Good day everyone, I'm Ando Dominic L. On today's discussion, we will be tackling about the blindness and low vision. So there are two general definitions of blindness. The first one is the legal definition that is based on the measurement of visual acuity, field of vision, and peripheral vision. You might ask, what is visual acuity? So visual acuity is the ability to clearly distinguish forms or discriminate details at a specific distance. The normal visual acuity is measured by reading letters, numbers, and other symbols from a chart 20 feet away. The Snellen chart is commonly used for this purpose. So the sizes of the letters in the chart corresponds to the appropriate distances where they can be read with normal vision. Thus, when a person can read the row of letters marked 20 over 20 correctly, he or she has normal vision. His or her visual acuity is 20 over 20, that is, he or she can read the letters that normal vision permits to be read 20 feet away when seated 20 feet away from the chart. On the other hand, if a person can read the row of letters marked 20 out or 20 over 70 only when seated 20 feet away from the chart, his visual acuity is poor. Normally, the large letters can be read at a distance of 70 feet, or when a person can read the rows of letters marked 20 over 200 only when seated 20 feet away from the chart, his visual acuity is poor that it falls within the range of blindness. However, there are people whose visual acuity in one eye is better than normal at 20 over 10. So this means that the better eye can see at 10 feet away what normally can be seen at 20 feet away. So on the other hand, the field of vision refers to the area that normal eyes cover above, below, on both sides when looking at an object or when gazing straight ahead. The field of normal vision covers approximately a range of 180 degrees. When looking directly at an object, the central field of vision is used. Peripheral vision covers the outer ranges of the field of vision. A person may have poor central vision but good peripheral vision. Tunnel vision results from an extremely restricted field of vision. It is like looking at the objects in the environment through a narrow tube or tunnel. The field of vision can decrease slowly undetected among children and adults over a period of years. A complete eye examination should include both visual acuity and field of vision. And now let's proceed to the legal blindness. Legal blindness refers to the condition where visual acuity is 20 over 200 in the better eye after the best possible correction with glasses or contact lenses. The field of vision, whether central or peripheral, is limited to an area of 20 degrees or less from the normal 180-degree field. A legally blind person with his or her eyeglasses or contact lenses on can see or read only at 20 feet objects and letters that those with normal vision can see or read 200 feet away. The person experiences difficulties in everyday activities, especially in discerning fine details of objects and things in the environment. On the other hand, let's proceed to the educational definition. So not all legally blind persons are totally blind. In total blindness, the person is absolutely without sight but may have light and movement perception and travel vision. The degrees of blindness include light perception. On this, person can differentiate between light and dark, day and night. Next, we have movement perception. On this, person can detect if an object or person is in motion or in still position. And lastly, we have travel vision. So on this, a field of vision is enough to travel safely in familiar areas. Although classified as blind, the person can still use his or her residual vision. So in special education, children who are blind are differentiated from those who have low vision. Blind children use their sense of touch to read braille and train in orientation and mobility to move around and travel independently. A child with low vision learns to read materials in large print. Korn's definition of low vision, cited in Howard 2003, emphasizes the functional use of vision. So low vision is a level of vision that with standard correction hinders an individual in the visual planning and execution of tasks, but which permits enhancement of the functional vision through the use of optical or non-optical aids and environmental modifications or techniques. And now let's proceed to the process of normal vision. So the sense of vision is a complex and intricate physiological system. There are three elements necessary for good vision to take place. These are a pair healthy, intact, and efficiently functioning eyes with the complete parts, well-lighted objects and images, and a healthy brain. And now let's proceed to the anatomy and physiology of the human eye. The parts of eye that we see on the face are only a small part of the total mechanism for seeing. The eye is a complex part of the human body that no other organ can equal. There are 5 physiological or physical systems in vision. Namely, first we have the protective structures, second the refractive parts, third the muscles, fourth the retina and the optic nerve, and fifth the brain where vision takes place. So let's start with the protective structures. The protective structures surround the eye to protect it from harm. These are the bony eye socket in the skull and the protruding bones in the cheeks and forehead, the lacrimation system or tear ducts, the eyebrows, eyelids, and eyelashes. The eye socket, which contains the eyeball where most of the parts of the eye are found, is comparable in size to a ping pong ball. It protects the sensitive mechanism for vision from trauma, together with the bones of the cheeks and forehead. The tear ducts or lacrimation system, on the other hand, protects the eye by secreting fluid or tears that clean and keep the eye moist. The eyelid moistens and cleans the cornea through blinking. The eyebrows and eyelashes catch foreign bodies that may enter the eyes. And now let's proceed to the second physiological or physical system in vision, which is the refractive structures. The refractive structures bend or refract light rays so that the image of the object focuses on the retina. So these are the cornea, aqueous humor, pupil, iris, lens, and vitreous humor. The cornea is the curved, transparent membrane that protects the sensitive parts of the eye. It is the front window of the eye that starts the process of vision by bending the light rays into patterns or images. Then the light rays pass through the aqueous humor chamber, which is one of 2 fluid-filled chambers. The aqueous humor is a watery liquid that fills the front chamber of the eye to keep the eyeball properly inflated. The pupil, on the other hand, is a circular hole in the center of the colored iris. So the pupil constricts or dilates to regulate the amount of light entering the eye. It constricts or closes to a tiny circle in bright light and dilates or opens wide in darkness to allow as much light as possible to enter the eye. The lens, on the other hand, is a transparent and elastic little envelope of fluid suspended by tiny, strong muscles. So the lens adjusts its thickness so that both near and far objects can be brought to focus on the retina. The fluid fattens the lens for near vision and makes it flat for a distant vision. The lens moves at an average of 100,000 times a day, which is equivalent to a 50-mile hike to the leg muscles. Like the aqueous humor chamber, the vitreous humor chamber, on the other hand, is filled with fluid. The vitreous humor is a jelly-like substance that has the consistency of an egg white, but still clear enough for light to pass through. The vitreous humor fills most of the eye's interior. So now let's proceed to the third physiological or physical system in vision, which is the muscles. So its function, so the function of the muscles is to coordinate and balance the movements of the eyes. They turn, raise, and lower the eyes in response to cranial or brain nerve impulses. The fourth physiological or physical system in vision is the retina and optic nerve. The retina is a multi-layered sheet of nerve tissues at the back of the eye. The retina is the last part of the neural receptor system for vision. It is likened to the film in the camera for a clear image to be transmitted to the brain. The light rays must come to precise focus on the central portion of retina. The retina contains some 137 million light receptor cells and called rods and cones. 130 million of these receptor cells are shaped like rods for black and white. 7 million are shaped like cones for color perception. The rods are responsible for night vision or for seeing objects and images under conditions of low illumination. All 37 million light-sensitive receptors are contained in an area that is less than a square inch. The most sensitive part of the retina is the macula, at the center of which lies the fovea, the area that is vital to the exact discrimination of the details of an image or object. The optic nerve is connected to the retina and conducts visual images to the brain at a speed of 300 miles per hour. And last physiological or physical system in vision is the brain, where vision takes place. Vision takes place in the occipital lobe of the brain located at the back of the head. Occipital lobe is one of the four lobes of the brain that are named for the major skull bones that covers them. Audition or hearing takes place in temporal lobe, found behind the forehead. The parietal lobe at the top of the head toward the rear processes body sensation. The frontal lobe is a part of the cerebral cortex in the cerebrum or forebrain, which is the largest part of the brain that governs the highest function associated with conscious activities and intelligence. The frontal lobe also controls the movement of voluntary muscles. You might ask how vision takes place. So the basic function of the eye is to collect visual stimuli and information in the form of mechanical energy from the environment through the psychological process called sensation. The eye has tens of millions of electrical connections that are capable of handling as many as 1.5 million messages at the same time. During the process of vision, the stimuli are converted into electrochemical form or the nerve impulses through the process of transduction. The nerve impulses are desired as the language form that the brain understands. The optic nerve conveys the nerve impulses to the occipital lobe of the brain, where perception takes place in the form of visual images. So there are three conditions for vision to take place. First, the eyes are stimulated by light rays or illumination, which are in the form of mechanical energy. Second, the light rays are reflected from object in the visual field. And lastly, the mechanical energy is converted into nerve impulses, which the brain processes into visual images. The light rays pass through the cornea, then the aqueous humor chamber, then the pupil, the lens, and the vitreous humor. The light rays come to a clear focus on the retina. The optic nerve conducts the visual images to the brain, where perception of the visual experience takes place. And now let's proceed to the types and causes of problems of vision. The inability of the eyes to function efficiently may be treated to: first, errors of refraction; second, imbalance of the eye muscles; third, diseases; and fourth, trauma or accidents. So let's start with the errors of refraction. After the light rays enter the cornea, aqueous humor and pupil, and the lens fails to refract or bend the light rays to focus on the central part of the retina, errors of refraction occur. In hyperopia or farsightedness, the lens fails to focus the light rays from near objects on the retina, or on the other words, can see better at far distances than close up. So in myopia or nearsightedness, the opposite takes place. This time, the eyes are abnormally long from front to back, and lens fail to refract the light rays from distant objects on the retina. Or it means can see better at close range than at distance. And in astigmatism, the cornea which normally forms a portion. If a spherical lens indeformed, the refraction of light rays becomes family and blurred vision results. Or in other words, astigmatism is a focusing problems whether stimuli are near or far. It is usually present at birth and may cause headaches, nausea, or tired eyes. The second one is the imbalance of the eye muscles. When the muscles of both eyes do not work together in a coordinated way, imbalance of the eye muscles occur. In strabismus, different images are cast on each retina resulting to a cross-eyedness or squinting. Diplopia or double vision, on the other hand, results when the brain cannot fuse the differences in the images cast on the retina into a single image. The condition can be corrected by prescription lenses, exercises, surgery, or a combination of the three. Amblyopia occurs when vision is suppressed in one eye and it becomes weak or useless. Nystagmus is a condition in which there are rapid involuntary movements of the eyeball that can result to nausea and vomiting and dizziness. In some cases, nystagmus is a sign of brain malfunction or inner ear problems. The third one is diseases of the eye. Among the diseases of the eye that cause blindness, cataract is the most common in the Philippines. Cataract is caused by the clouding of the lens, which results to progressive blurring of vision and eventually blindness occurs. The disease is associated with the aging process, but it can occur early among persons with diabetes mellitus. Children can suffer from congenital cataract. On the other hand, we have diabetic retinopathy that occurs when diabetes mellitus interferes with the flow of blood to the retina, causing it to degenerate. Diseases of the cornea are the second leading causes of the blindness in the country. Injuries and infections due to the accidents and malnutrition scar the cornea, which shows as a whitish spread. Corneal scar is commonly called pilak. Diseases that destroy the cornea cause blindness. The cornea can be removed and changed with a healthy one through corneal transplant. Diseases of the retina, the most sensitive part of the visual mechanism, can be congenital or present at birth. Many of the diseases are due to prenatal causes, that is, they occur during pregnancy. Colobomas is a degenerative disease in which the central and or peripheral areas of the retina are not completely formed. This results to impairment of the visual field and central visual acuity and blindness. Retinitis pigmentosa is a hereditary condition that results in the degeneration of the retina. The field of vision becomes narrow and eventually results to blindness. Glaucoma is a condition in which there is excessive pressure in the eye. And the last one is the trauma or the accidents. A 24-year-old teacher usually goes to sleep in the minibus that he takes every day from his home to school. One afternoon, the minibus was dumped from behind by a jeepney, shaking passengers and bruising some of them. Unfortunately, the teacher, who was fast asleep, hit his head hard against the seat's wooden back. Since then, He complained of dizziness, severe headache, and blurring of vision. After a thorough examination, the ophthalmologist diagnosed the condition as retinal detachment. The severe blow on the head traumatized the eyeball and caused the retina to break off from it. The teacher became totally blind since then. Another traumatic accident involved a successful blind supervisor at the Department of Education. She recalled how she lost her vision at the age of 7. She was playing espadahan that time with her friends when one of them hit her left eye with a wooden stick. The eye became infected and she suffered from monocular blindness in the left eye. Before long, the right eye sympathized with the left eye and the girl became totally blind. And now let's learn what rubella or German measles is. So rubella is a mild disease in most people. The danger is that pregnant who come in contact with someone with rubella, especially during the first 3 months of pregnancy, risk having a rubella baby. A rubella baby can have serious problems such as permanent damage to the eyes and ears, including blindness and deafness, heart disease, and brain damage. In fact, rubella is responsible for 95% of deaf and blind babies. Since February 1989, rubella has been added to the measles or mumps vaccine to make the 3-in-1 measles, mumps, rubella vaccine. Childhood immunization against rubella is also important because the rubella infection is sometimes so mild in children that there are no visible signs of illness. But they are still able to pass the infection onto unsuspecting pregnant women. So what are the symptoms of having rubella? Rubella is usually a mild illness with a rash and a fever. A mild headache accompanied by a slight fever and swollen lymph glands of the neck may appear about 2 days before the rash. The rash appears as blotchy brownish red spots on the face and neck. Pink spots like the rash or scarlet fever may also be seen. The rash spreads to the other parts of the body, tending to disappear from one side as it appears in another. As many as half of the infections may occur without an obvious rash. An attack lasts also from 2 to 5 days and may be accompanied by mild catarrh and fleeting pains in hands and feet. So these joint pains may occur after the rash has disappeared. Children may have such mild attack that there are no noticeable symptoms, so it is possible to be exposed to the disease without knowing it and even to be unaware of contracting it. Rubella is sometimes mistaken for the more serious ordinary measles or other viral infections. Obvious differences are that the rubella rash fades more quickly and does not leave the brown discolorations caused by ordinary measles. You might also ask how it spreads. The virus is present in an infected person's nose and mouth. It spreads to others through droplet infection in cough and sneezes, by direct contact such as kissing, by handkerchief, towels, beddings, and eating and drinking utensils, and other items contaminated by the virus. Incubation period is from 14 to 23 days. The contagious period is from 1 week before to as long as 4 days after the rash appears, when an infected person can pass on the diseases. So how to protect others from rubella? Because others in the same house as an infected person could contract the disease or become unsuspecting carriers of it, an expectant mother who comes in contact with them should be warned when rubella is in the house. If a mother-to-be contracts rubella or is exposed to it, she should see her doctor immediately so that steps can be taken to minimize the effects of disease on her developing baby. Children with rubella should be kept away from school until they are fully recovered. And lastly, let's talk about who should be immunized. So all children aged between 12 and 15 months. Girls aged between 10 and 16 years old. Women of childbearing age who have not previously been immunized. Women who are planning to become pregnant. Rubella immunization should not be given to women who are already pregnant, women who may be pregnant or who may become pregnant within 3 months or receiving the vaccine, people suffering from fevers or serious disease like cancer, and people taking cortisone-like or immunosuppressive drugs. Before immunization, the doctor must be told about any chronic illness, infections, or allergies, whether the person is taking medication or has received immunization within the past month. So I think that concludes my report. Thank you so much for listening, and God bless us all.